Dr. Price, can you give us some insight into what you and Banner are seeing when it comes to children who are being diagnosed with COVID-19?
Yeah, we're certainly seeing children that are getting infected with this virus. And in some of them, they're sick enough to get admitted to the hospital. And every week we have children that get admitted with this disease.
Are there fatalities associated with the virus?
So certainly children can die. In the US, we have been seeing that. I personally, fortunately, have not had any of my patients that have passed away yet. I suspect that's somewhat lucky, to be honest with you. It's probably just a matter of time.
The Centers for Disease Control this week announced approval for the Pfizer vaccine for ages 5 to 11. What is your recommendation to parents who are weighing this decision?
I fully recommend getting vaccinated with this vaccine. In fact, I have two of my own children that are in that age group, and I just set up an appointment to get them vaccinated for it.
Dr. Price, you'll know this as a parent, of course, but parents don't hesitate when they go see their pediatrician for measles, mumps, rubella vaccines. But to be fair, those have been on the market for decades, and there have been extensive research components involved with that. Not so much with COVID-19. How do you rest their worries?
Yeah, so anytime something new comes along, you always wonder, is it going to work? Is it going to be safe? And I totally get wondering about that with this new vaccine. It's come out in record time. It's something that's brand new. We don't have years and years and years of experience like we've had with these other vaccines, like you mentioned. The good news is that this has been tested on thousands of children. It has been shown to be safe and effective. The vaccine producers didn't cut any corners. They still had to follow all of those steps along the way to make sure that this was safe and that it is infected, that it is effective. And so it should work just fine. Um, I don't see any reason why it wouldn't at this point in time. Again, we don't have a lot of experience moving forward yet, but the experience that we have had and the amount of children that have gotten vaccinated, it's turned out very well. There are some side effects that are possible. Most of those things are typical common things, but there are some more serious things like myocarditis. Myocarditis is inflammation of the heart. And they've seen some children who got that after getting the vaccine, and they've definitely seen that happen with children who got it after getting the infection itself. The good news is that the risk of myocarditis is very low. And the risk of myocarditis with the actual disease is actually much higher than it is with the vaccine itself. So, long story short, it's a good vaccine. It works very well, and it does seem like it's very safe for children.
Can you offer a guarantee to parents that there will be minimal risk or reaction should they decide to vaccinate their child with this Pfizer vaccine?
Yeah, so nothing is 100%. So I always let people know that. So there's always a chance of a problem with anything we do, whether it's getting into a car, taking Tylenol, that sort of thing. All those things are associated with risk. It'll be the same thing with this vaccine. But again, the good news is that risk of problems, and especially severe problems, is very, very low. I tell people if they are really trying to avoid risk, at this point in time, the best way to avoid risk is to get the vaccine because the vaccine solves very many more problems than it causes at this point in time.
I want to ask you about the advisors to the Food and Drug Administration. There were some advisors who were expressing hesitancy, and people are consuming the media through various platforms, and they see that and they think, wait a minute, now I'm not so sure. What do you say?
I think that's a really good thing. So for someone not to rubber stamp it is the important thing, right? So the people that were expressing concern were really doing their due diligence and looking at the data to say, was this safe and will it be effective? And does it apply to all children or should there be subgroups that we prioritize it in? And so I think it's a good thing that they looked at that and did their due diligence. And I'm glad that there are folks that are out there that are being the skeptics, that are making sure that everything is looked at very closely to make sure that we're doing the right thing.
Um, it is cold and flu season. Undoubtedly, children are coming down with things that are pretty typical this time of year. You're a parent. How do you advise other parents about what to watch out for?
Yeah, so it's really hard because regular colds, regular flu, and then COVID can all look the same early on. And so really what I tell people is if you're having a hard time breathing, if you are not able to keep fluids down or getting dehydrated, by all means go in and seek care. If it's just regular kind of I got some coughs and some runny nose and with or without fever, you can usually take care of that sort of thing at home. And I always recommend that you stay away from others when you're sick. That way you don't share those germs with other people. And we see kids get sick from all of these things, and some of them can actually do very poorly with any one of these things. And it really just depends on the person and how their immune system works and how they respond. So, again, just try not to be around people when you're sick and take care of yourself.
Dr. Nathan Price from the U of A College of Medicine in Tucson. Thank you.
You're welcome. Thank you.